COVID-19 surely had an impact on fraud, corruption and waste. The measures taken by the different countries to combat the epidemic caused new types of abuse. For example, by the use of medical equipment necessary to combat the epidemic.
I think there are two main lessons, two main challenges. One is to secure the stockpiling of the personal protection equipment, of certain medical equipment that is needed. In this case, I would say, especially for respirators. Also, keeping a closer eye on the number of qualified and well-trained health professionals. I mean, not only doctors, but also nurses who have to work with highly critical patients. On the other hand, most healthcare systems are worried or have been worried on the indirect impact of the crisis, of the pandemic, on the non-COVID services. So non-COVID services mostly have been suppressed, at least during the big waves of the pandemic, and they caused a lot of harm to especially chronic patients, also in some cases to acute patients. And this might have an impact for the future years. So I would say that now the main idea is how to organize services in such a situation to preserve the regular, at least most of the regular functioning of the system, while securing the services for the critically ill and for the big numbers of critically ill patients. Many European systems, unfortunately, don't have many reserves, and that's why they had to resort to that. So they simply had to take, especially the personnel, from non-COVID services in order to support the care for the critically ill patients.
We need to recognize that COVID-19 pandemic was a very unique situation where we need to learn actually from our mistakes, and the next step is to improve, actually to ask ourselves what are our priorities and what are our future plans with regards to quality improvement strategies. Secondly, I think that engagement and empowerment of stakeholders related to public health, this is a very important issue, clear leadership roles. Lesson number 3, I think that collaborative mindset and synergistic actions, and there has been a lot of them, like for example the One Health initiative, HERA, the EU Emergency Preparedness Plan, and of course at last I think that one of the lessons learned are the missed prevention of opportunities and the antibiotic misuse and overuse. So here there is a lot of space for improvement, and probably these are also the main priorities that we should focus on in the future, in the post-COVID era.
Well, in the future, what we need to really think about is how do we bring all of the stakeholders within the health system together so that they are aware that now in a digitized society are the patients and the populations that we serve, they seek information differently than before, and they also interact with the health system differently as before. So if we make sure that different stakeholders of the health system communicate with each other, talk to each other, and are prepared to understand signals from harm of the infodemic early enough, that means that we can all work together to respond to prevent the infodemic and the harm that it causes, both to individuals and to the population health, and of course then also any harm and any stress that it causes on the health system.
During this pandemic, European countries had to provide their citizens material in a very fast way. Individual protection devices, big devices like a respiratory machine, pharma and vaccine. To do that in a very fast way, they have to bypass all the purchasing rule that that exist in order to protect our system from fraud and corruption. This led to an increase in fraud, corruption, and waste. Many cases came out in the news. Many others are at the moment under the attention of the judiciary power. We cannot know at the moment which is the global impact of this. But I think the network should work in the next month and year in order to assess this global impact on the waste.